Very good afternoon, students. This is a short video for the arterial anastomosis around the scapula, around the body of the scapula. So the title is arterial anastomosis around the scapula, that is the body of the scapula. What is arterial anastomosis? In previous videos, I have explained the anastomosis between the various blood vessels. Okay, it will be the arterial anastomosis, it may be arteriovenous anastomosis, or it is the venous anastomosis. Okay, so this is the anastomosis between the adjacent arteries or branches of the adjacent arteries which are located around the scapula, which is an important arterial anastomosis. Now here for the arterial anastomosis, which are the branches of the arteries which are taking part. Here is the dorsal scapular artery. Okay, so this artery, dorsal scapular, which is taking origin from the subclavian artery. Then the supra-scapular artery, which is also a branch from the subclavian artery, that is number 2. And the third is the circumflex scapular. See this branch, which itself is a branch from the subscapular artery. Let us see these branches which are taking origin from the two different important arteries. Now this is the brachiocephalic trunk. This is the right scapula as we are seeing it from the back side. So this is the right we are seeing. So on the right side, from arch of aorta, there takes origin the brachiocephalic trunk, which divides into the common carotid artery and the subclavian, right subclavian artery. Now this right subclavian artery, then it travels at the root of the neck, and this is the right which comes into the axilla, and when it comes into the axilla through the apex of the axilla, then it is called as the axillary artery. So this is the subclavian artery here, and then this is the axillary artery. So this anastomosis is between the branches which are taking origin from the subclavian artery and the branches which are taking origin from the axillary artery, which you must have seen in the axilla upper limb. Okay, let us see here from the subclavian artery, the first artery which takes origin is the vertebral artery, which goes to the brain, and then this is the internal mammary artery or internal thoracic artery, which goes into the thorax behind the costal cartilages. Then the third branch which takes origin from the subclavian artery is the thyrocervical trunk. Okay, so this goes to the thyroid gland and to the various parts of the neck. This is the thyrocervical trunk. And then this is the transverse cervical branch, which will give the two different branches. One is called as the dorsal scapular, which will come on to the dorsal aspect of the scapula near the medial border. This is the midline. So this artery is coming on to the back of the, on the back, and this is close to the medial border of the scapula. This is called as the dorsal scapular artery. Another branch from this thyrocervical trunk is this artery, that is supra-scapular artery. So this was dorsal scapular, this is supra. They are branched from the subclavian artery. The first part of the subclavian artery, I would say from thyrocervical trunk, which itself is a branch of the subclavian artery. And this runs here and goes to the upper border of the scapula, where is the supra-scapular notch is located. Okay, supra-scapular notch is located, and this goes on to this ligament, that is the supra-scapular ligament. Okay, just above the supra. So if I draw the supra-scapular ligament here, this will be a ligament which converts it into foraminal through which passes the nerve, supra-scapular nerve. But the artery passes just above it. Okay. So very close to the then it divides into many branches in supra-spinous fossa, and then through the spinoglenoid notch, this artery comes to the infra-spinous fossa here exactly. So this comes through this notch to the supra-spinous fossa, then through this spinoglenoid notch, it comes to the infra-spinous fossa and divides in multiple branches. Not only it comes on dorsal surface, it also sends branches onto the ventral surface of the scapula. So both the surfaces are given the branches by this anastomosing artery. So this is the number 1 supra-scapular artery. Okay. Then the second branch from subclavian is the dorsal scapular. This also gives branches and lies close to the medial border of the scapula. It sends branches to the supra-spinous fossa, to that of the infra-spinous, and also on to the ventral aspect, which is the subscapular fossa. Okay. So these are the branches which are given on both the surfaces, okay, of the scapula. Then these are the branches from the subclavian artery. Okay. Then the branch which take part in anastomosis is from the third part of the axillary artery. There are branches from first part, there are branches from second part, and this is the branch from the third part of the axillary artery, which is called as the subscapular artery. The subscapular artery, as it lies close to that of the lateral border of the scapula, this gives a circumflex branch, what is called a circumflex scapular branch, which winds around the lateral border, and then it breaks up into many branches on both the surface, infra-spinous fossa, as well as into the subscapular fossa. And all these branches from these 3 arteries, 1, 2, and 3, they form an anastomosis both on ventral as well as the dorsal aspect. This is called as an anastomosis or arterial anastomosis, okay, on the body of the scapula, both on ventral as well as onto the dorsal aspect. Why this anastomosis of arterial anastomosis takes place? The importance of this arterial anastomosis is that in case of any blockage or in case of the ligation or rupture, okay, there will be anastomosis or bypassing of the blood anywhere after the origin of the thyrocervical trunk. If there is a blockage here, if there is a blockage here, if there is a blockage here, anywhere if there is a blockage just above the origin of circumflex scapular and after the origin of the thyrocervical trunk, any blockage, any ligation, if it is needed for the surgery, you can very well ligate or the blockage will taken care of. Why? Because the blood which is flowing through the supra-scapular and the dorsal scapular artery will have a free anastomosis with the branches of the circumflex scapular, which is a branch of the subscapular, which itself is a branch from the third part of the axillary artery. So the blood can bypass, okay, and it will go to the upper limb. That means the blood will come here, then into the anastomosis, then into the anastomosis, then it will pass here and will start bypassing here. So it has come from here, okay. Even though it is the blockage is here, it will come here and it will go to the third part. So there will be not any problem, okay, in the survival of the tissue of the whole upper limb if this anastomosis is there, and in case if there is any blockage somewhere between the first part of the subclavian artery and that of the third part of the subclavian artery. Okay, so this is the applied importance of the anastomosis around the scapula. Thank you very much for watching this video.